Hey there, and welcome to the Think Fitness Life podcast. We're fueled by the incredible clients who inspire us every day, allowing us to elevate their health and fitness journeys. On this show, you'll gain valuable insights from top professionals, hear inspiring transformation stories, and discover the knowledge and motivation to create your own best life. Let's dive in. As someone who has continuously used therapy as a way to heal and elevate my personal performance, I know wholeheartedly that you cannot always read the label when you're in the jar. And that's why it's so helpful to have a professional in your corner to talk to. This podcast is sponsored by BetterHelp to provide our listeners with the opportunity to work with a licensed therapist from the comfort of your own home. Receive 10% off your first month when you sign up by going to betterhelp.com/TFL. That's betterhelp.com/T as in think, F as in fitness, L as in life. And remember, you're not alone. There are people out there who can help.
Welcome back to the Think Fitness Life podcast. From time to time, we like to have experts come on the show and dive into topics that the general public are not aware about. Big ones are TRT. Everyone has heard about it, or I would assume has heard about it, but not a lot of people know what it actually entails, but they hear people saying, I went on TRT, or you should go on TRT if the levels are low. We're going to dive into that. And the other side of things is a big thing that I've drinking at some point in my life, and many people have every day I see, energy drinks or stimulants to keep them up. What are safe alternatives to that? And are they really actually healthy for the human body? Because they are mass producing all these energy drinks that can't be health in a can. But we're going to welcome on Dr. Robert Beltran. Welcome on to the show.
Thank you very much. It's an honor, a pleasure. I'm very appreciative and thankful to be on your show.
So kind of your early background. You were a doctor way back when?
Yes, I have doctorate degrees in both pharmacy and medicine from the University of California at San Francisco. I became a surgeon, double-boarded surgeon, American Board of Otolaryngology, Head and Neck Surgery, American Board of Facial Plastic and Reconstructive Surgery, and I practiced medicine for 31 years.
And when you were doing that stuff, what was your primary practice? What was your area?
Always did a lot of work related to noses. So whether it be a functional nasal surgery to help people breathe better, a functional nasal surgery associated with some degree of sinus surgery, or functional surgery associated with cosmetic surgery, or just cosmetic surgery, that was definitely the procedure or series of procedures, if you will, that kept me really, really busy.
Now, I got to ask, what kept you intrigued about the nasal pathway in the nose? Because for most people, they're going to hear that and be like, okay, another nose doctor. But I hear that and I go, okay, you're changing people's lives through airflow, through autonomics, influencing their overall health and well-being. What got you into that stuff? Because it's a big, I don't know, it's not an organ, but it's a big part of the cranium that really regulates a lot of the rest of the body.
There, you nailed it. I wanted to be a surgeon from day one. I knew I wanted to be a surgeon. My favorite TV show growing up when I was a teenager was Medical Center with Chad Everett. And he was a young, vigorous doctor and surgeon at UCLA Medical Center, and he became my hero, so I knew I wanted to become a surgeon. Once you get into medical school and start doing your rotations, you rotate through all kind of different specialties, and it was difficult for me to determine exactly what area I wanted to go into. But then I came to realize that the otolaryngology, head and neck surgery, or what most people call ear, nose, and throat, was kind of a gentleman's surgery. We could do big surgical procedures in terms of removing tumors from the oral cavity, the neck, and have to reconstruct those deficits. We could do microscopic surgery of the airway, the larynx, the trachea and whatnot. And of course, the functional and cosmetic procedures involving the nose and the face. And then if you were attuned to it and felt you had the skill set, microscopic surgery involving the middle ear. So it was a very broad specialty with a lot of different areas I could delve into. And I told you earlier, eventually I focused on the nose and the sinuses as my primary set of procedures.
That's awesome. It's always cool to hear people's background story of how they got to where they got to in their career and kind of what drove them to it. And most people, that's why we sit down. I love sitting down and talking to people and learning from them because most people don't appreciate the human body like you or I do.
Yeah, the human body, we need to take care of it. It should be everyone's primary, number one priority. Anyone 18 to 80, that should be their number one priority. And that's one of the things I'm set out to try to help people understand what the book we're writing and the messaging through our website. And every time we have a chance to interact with our patients, we're letting them know your health should be your number one priority. And excellent and good health is not a one single situation, not an elixir, not a pill, not one specific exercise. It's a lifestyle. It's a holistic lifestyle. You have to make sure you have exercise. I think people should do some form of exercise on a daily basis. And I think if they can get 3 to 4 days of vigorous exercise in, that is optimal. They should meditate daily for 15 to 45 minutes. Why are those two things so important? Exercise has a double pronged benefit. One, it increases the microcirculation throughout the body. We all know that microcirculation is so vital to the health of our tissues and the longevity of our tissues. And both of these, exercise and meditation, flood the body with endorphins, which are the body's natural opioids, and what we call feel-good neurotransmitters, dopamine, serotonin, and gamma aminobutyric acid. So those two things are extremely important. And then, of course, a healthy diet. I don't want to get into the details because that's a discussion in and of itself, but basically stay away from processed foods, fried foods, refined sugars, artificial dyes, and do everything you can. Do everything you can to moderate your carbohydrates, your dairy products, your alcohol, and try to keep your weight at or below a BMI, a body mass index of 28. And that's important because above 28, you start becoming obese, you get diabetes, hypertension, and of course, cardiovascular disease. I personally see these as a continuum.
Yeah. And a lot of people, that's the thing, a lot of people don't see it as a continuum. They're like, well, this must have just happened because of age. They're not seeing what their lifestyle is adding to it. And one big thing you mentioned is nutrition. And off air, before we hit record, we kind of got into what we're going to talk about today. How is like nutrition driving hormone levels to be plummet? And nowadays, like you said, the testosterone, especially for men, I would say even females, we're seeing lower and lower levels of this as we age. And I wouldn't say as we age, as we go from generation to generation. And I wouldn't say there's warnings, but there's that data out there. The testosterone is much lower than it was 40 years ago. So I know this is a burning topic for you. What is, for you, getting into that safe alternative to TRT or HRT? Because that's a big role player now when people ask, how do I do this? Like you said earlier, people look for a quick fix.
You just hit a very important topic. So yeah, TRT levels are plummeting in men. I call it from 3 different aspects. One is their diets. Of course, they're overburdening their digestive tract, causing too much of their circulation to be involved in the metabolism of these difficult to digest foodstuffs that the body wasn't naturally made to digest. Number 2, way too much stress. Number 3, way too much alcohol. So if men can control those 3 factors, they're going to see their libido and their ability to enjoy the fulfillment of sex at a much higher level. And there's something very important that men should understand. 2 things that are very important. Number 1, your libido is a reflection of your overall health. If you have low libido, you better come to an understanding that you're not a healthy individual. And number 2, numerous studies, this is not me, numerous studies have shown that a healthy and fulfilling and semi-regular or regular sex life, intimacy, is associated with physical, emotional, mental, and spiritual health and well-being. So those are 2 very important considerations. Let's answer the question you asked. The use of testosterone replacement therapy, TRT, is an epidemic. And it's endemic because it's being marketed everywhere. And the concern is that it's being marketed as if it's just super safe. And men should have no concerns about taking it. And Us in medicine, we state that only men that should be taking it are men that have a blood testosterone level that's below 400 nanograms per deciliter. So a normal range of testosterone is from 400 to 800 nanograms per deciliter. And if you get anywhere close to 600, you are going to start having side effects. And those side effects, it's a myriad of side effects. I'll mention just a few: thinning of the hair, protuberance of the forehead, loss of hair, rounding of the face because of retention of fluid, and thickening of the facial muscles, a direct effect of the testosterone. And then these men start looking a lot older than their stated age. And they get deep furrows in the forehead, and their face starts looking like a deflated basketball. And that's happened to a lot of men. Number two is, yeah, initially you have a very strong libido and you start enjoying the fulfillment and pleasures of intimacy, but you can have a reversal of fortune, and it happens to a lot of men because they turn off the hypothalamic pituitary gonadal axis, and their ability to form their own testosterone in their body is compromised. So what happens? They go back to the doctor and say, hey, guess what? My libido's not what it was. I'm not enjoying intimacy like I did. And guess what they do? They give you more testosterone. They give you a higher level. And you start having more and more of the side effect. The other issue that's very concerning is this whole thing associated with testosterone that's associated with anxiety, irritability, anger, and rage. We've all heard of steroid rage. What happens with testosterone also? And it's gotten a lot of men into trouble domestically, professionally, and legally. And the reason that happens is because we turn off another very important neural pathway, the hypothalamic pituitary adrenal axis. And of course, it's our adrenal glands that help us moderate our response to stress. So these are very important concepts that men need to consider. I know that for a fact, because I have talked to numerous men who have gone to these clinics, they hype up the benefits and they totally minimize the side effects. And so men are getting themselves into a situation where I think in 3 to 5 years, we're going to see a lot of men that are some side effects that are causing them some significant compromise in their lives. So we're putting them on notice, and hopefully listen.
When people go to the clinics, because I've never actually talked to someone who's gone to a clinic, I would assume because it's the part of the clinic is to get someone on TRT. Would that be correct?
Absolutely.
Like they're going to kind of say, hey, we can get a fix. And like you said, the biggest thing is for any, like once you start going exogenous source of a hormone or something else, it's going to downregulate something in the body, and you're probably going to have to rely on it for the rest of your life at some degree. And it's very important that people know that, like, it's not that, I think when you're younger and you hear about steroids, you're like, if you take anabolic steroids, like it's going to enhance your own stores and you're just going to get an extra boost, but it's not. Like your brain's just saying, hey, we don't need any more. We're shutting down. We're done.
Yeah, it's interesting you said that. You used the word anabolic steroid, and these people will argue with you all day long. I'm not taking anabolic steroid. I'm taking testosterone. Well, guess what? It's exactly the same chemical makeup. So, yeah.
And that's why I said it, because people think like, oh, TRT is different than there's different anabolic steroids, but like the pathways, no, it's all testosterone. Like the point is to get your testosterone stores to get jacked up in the body without your body actually doing it.
And one thing we didn't talk about, which is very, very important, very vital, is the longer men take testosterone replacement therapy and the older they get, the more susceptible they become to cardiovascular disease. There are some studies that aren't biased by the pharmaceutical companies, because most of the research now that's coming out is supported by the pharmaceutical companies. And so these researchers, these so-called experts that they have designated are biased. They're tainted. Their work is compromised because their work is being funded by the pharmaceutical companies. And then the pharmaceutical companies use this meta-analysis, which combines different studies. Well, of course, those are stuffed with studies that come from research that they've sponsored. The whole area is compromised, and men have to understand there are very definitive and potentially dangerous side effects that come with taking testosterone replacement therapy. We formulated the product. I formulated the product. I was very much involved. I brought all the, after I did, I studied this stuff for 6 years before I decided to create my own formulations. I came to a really good understanding based on my background in pharmacology and clinical medicine of what these various herbal ingredients were capable of. What they were capable of, there were those that complemented each other. You had a 1+1=2 effect. And then you had ingredients that we found that were synergistic with one another, where you had a 1+1=4 type of effect. We did our homework. We did it scientifically. We engineered these products to be very specific in terms of the benefits they provide. And our product, Man Plus, has 95% of the benefits that testosterone replacement therapy has. It increases brain power, cognition, and brain health and energy. It increases muscle tone and strength. You don't get that dramatic effect in muscle mass, but who wants that? I mean, there's too many men walking around who look distorted in terms of their body makeup compared to what their overall configuration is. And our product is healthy. You're not going to have any cardiovascular effects. The side effects are negligible. We're talking about things like digestion and indigestion. And it's going to give you all the benefits and then some. In fact, we feel very strongly that based on the research we've done, the studies we've done, and the comparison studies we've done, that our Man Plus has greater benefits in terms of libido and, more importantly, men being able to enjoy the fulfillment, the benefits, and the pleasures of intimacy compared to anything else out there in the market. In fact, when we did our studies, we had a number of men who were already taking Cialis, Viagra, or other 5-phosphodiesterase inhibitors. And when they came in and started taking Man Plus, we checked the touch bases with them as part of our study via questionnaires at 2 months, at 6 months, at 12 months, and at 18 months, and asked them, well, explain to us how the benefits compare to when you were just taking the Viagra or Cialis. At a minimum, they all said it amplified the benefits 5-fold. I think that in and of itself shows that our product has tremendous potency.
And that's one big thing I think for especially men nowadays, and I think you have a female one too. But we'll get that saying. But for men that are looking for that boost in testosterone or overall testosterone health, and not particularly saying, hey, I want to go on TRT, because for someone like me, it's always in the back of my mind that you hear testosterone levels are dropping, but I'm never considering I need to go on TRT. I'm saying, how can I just keep mine optimal and live the lifestyle I'm doing?
You nailed it. That should be the question that men should ask themselves there. And what this does, our product, it increases your own testosterone that's produced in your body by increasing the amount that's formulated in your testicles. And it also, a lot of people don't know this, there's 2 types of testosterone in the body. There's bound testosterone, it's bound to protein, it circulates throughout our body, it's inactive. And then there's free testosterone. The free testosterone, historically, it's like a 40% free testosterone, 60% bound testosterone. And what our products do, they increase the free testosterone significantly.
And now, correct me, because then you have DHT and then you have free testosterone. Like, it's interesting. I was listening the other day to something that said, well, a lot of the DHT, if that's high, like that's not driving muscle growth and in the anabolic process. It's more the other testosterone. And I'd never really thought about that before. I'm like, crap, that's crazy to think that, because we always think if you want to enhance testosterone, you want everything to enhance. But it makes sense when you talk about TRT, or if people are going on higher doses, and we can even talk about anabolic steroid users when they're on physiological crazy doses, they're going to get hair loss. They're going to get things changed different because DHT impacts that, and it can impact a lot of things.
You have to that's another one of the things I argue with these young guys all the time. These young guys, they think they're immortal. They think they're going to live forever. And they don't realize that some of us actually have to go to the emergency rooms, the ICUs, and the morgues And we see these things all the time where young people have sudden cardiac arrest. And the primary suspects are always energy drinks, Adderall, other amphetamine derivatives, cocaine. And cardiologists in internal medicine are starting to add TRT to that list. So it's sudden cardiac arrest is becoming an epidemic, and people have to be really careful who they listen to and what they do in terms of optimizing their health and well-being.
And is that a mechanism from the TRT impacting the growth of the heart because it is a muscle, or what is the mechanism driving that? Because when I was always growing up in this field, and you'd hear about these bodybuilders, and no one really paid attention to it. Another bodybuilder young died of a young age. We always just kind of assumed it was a heart issue because anabolics drive growth everywhere. What is the mechanisms for cardiovascular?
Where any and every muscle in the body is going to enlarge. That's why you see these men walking around with protuberant foreheads and rounding of the face. The rounding of the face is a combination of not only fluid retention, but enlargement of the facial muscles. But the heart muscle enlarges also. But more importantly, what TRT does, it increases your blood pressure and your contractility. That's the way the heart contracts. And unless you're wearing a Holter monitor all day long, you're going to miss these periods where your blood pressure gets excessively high. And over time, of course, this is going to lead to cardiomegaly, which is enlargement of the heart, and arterial stenosis, which is hardening of the arteries. And of course, this combination is a fast track toward hypertension, and then of course, cardiovascular disease, and increased risk of heart attack, stroke, and deep vein thrombosis. And deep vein thrombosis is problematic with TRT anyway, because one of the things testosterone replacement therapy does, it increases the number of red blood cells. It makes blood thicker and more sticky, and thus increases the risk of deep vein thrombosis.
Because it also drives EPO up in the body. Because now you're basically doing what we were designed to do through puberty, getting bigger dose of testosterone, but like you're not supposed to be doing that consistently throughout life from a separate source.
Exactly. If it's not coming from within your own body, it's guaranteed that at some point you're going to have untoward and compromising side effects.
And I always think, because our bodies are fascinatingly designed, that cell signaling is important. When you start putting stuff from the outside in to create cell signaling, how does that change the pathways? Like you mentioned,
you disrupt our human biology. You just and I already mentioned earlier 2 of the neural pathways, very important pathways that are disrupted by TRT.
And that was a fascinating one. You bring up aggression, because when you read it, that people that aren't on TRT or testosterone, like higher levels of testosterone really don't, it's a big correlation of driving aggression. It's more like it'll drive more giving and competitiveness. But always people think if you're completely natural, not taking anything else, you have high testosterone, you must be aggressive. But no, when you change the neural pathways and you start altering testosterone, and then we got to talk estrogen, you start altering the ratio of that stuff. That, I love what you said. That's when you're starting to change irritability, anxiety, and aggression, because people aren't used to their regular hormones being balanced in ebb and flow. All of a sudden it's like, oh yeah, switch just turned on and I don't know what to do.
Yeah, it's like you've turned off the faucet when you disrupt the adrenal gland as it pertains to our irritability, our anger, and our propensity toward rage.
And that's one gland no one wants to mess with.
I want to quickly, and you see it in various personalities that have a platform on television or podcast or whatever. There's 3 gentlemen that are part of the White House cabinet that are definitely on TRT. There's no ifs, ands, or buts about it. And then you see various podcasters and celebrities, and you can tell a mile away, not only by their appearance, by their confrontational, in-your-face type of mindset and personality.
I've just never, what you said, I've never thought about. That's fascinating now that you said that. Because now it's when I kind of look at that, I'm like, okay, he's got a point. He's onto something. But it's more prevalent that people are on TRT, and they're not going to tell you than I think I thought people were actually on TRT. When I was younger in the field, the big thing was, do you go on HGH or do you go on like straight testosterone, which would be a steroid? But now this whole world is changing because, yeah, I could go down to a clinic and probably get it sight unseen, right?
Synthetic inside on scene. A lot of these clinics do the testing that is required, but there's a lot of them that don't. And more importantly, you can get it online now, and your evaluation is a questionnaire.
Wow. That boggles my mind.
It's dangerous. It's dangerous.
So the natural way, and this is where I think a lot of people get confused. I want to dive into the Man Plus formula, because they'll go to stores or they'll hear this is a testosterone boosting supplement. What people think is they're taking testosterone in a pill form, but that's not true at all or one bit. It's a compilation of different herbs, different vitamins, different nutrients to help the system increase and support its own, let's say, a building of testosterone.
Well, that's why we have 20-something ingredients in all our formulations. You nailed it. It takes a wide array of not only herbal ingredients, but certain vitamins that are key and amino acids. You're not going to build muscle without amino acids. We have high quality amino acids in our product.
Oh, wow.
L-carnitine, L-lysine. And of course, you need stimulants to cause those amino acids to be productive as it pertains to muscle tone and strength and the physiological muscle growth you get with our product. And those would be things like concat ali, maca root, epidemium sagittatum, superba, tribulus terrestris, just to name a few.
Those are the big ones that some people have heard, but the ones I've heard and used myself. And there's one thing that the research goes back and forth on maca. I don't know your thoughts, but when I've always taken it, I've always felt like a boost. I'm sure that's one thing why you put it in there. Like some people, like, I don't really feel it, but all depends. Like for me, I've understood it's the dose, but it's like great to see it. And the other thing that when I look at it that had me question is, like, you put ginkgo biloba in there. Most people are going to be no idea what's going on with that. But if I think why you did it, I think it's genius. Is that to help, like, with the cardiovascular and help all that stuff, like along with testosterone support and like blood flow?
When we started our business, I told my team, I said, we have to achieve these things before I take our products to market. Number one, they have to be safe, negligible side effects. We accomplished that. They have to have very discernible benefits, subjectively and objectively. There's too many products out there, and some studies show as high as 50%, where people have no, and I'm talking about nutraceuticals, no discernible subjective or objective benefit. You have to ask yourself, are they having any benefit at all in my body? And let me give you one example. NAD+. People are taking NAD+ by the bucket loads. It's a $1 billion industry. There have been numerous clinical studies that have been done in major medical centers. None of them have ever shown that NAD+ has a subjective or objective benefits in any of the patients that have been tested. Getting back to our situation. Number 3, they had to stimulate vital and important physiological processes that we know are important for ongoing good health and longevity. And these are increasing the microcirculation on an ongoing basis, promoting neurogenesis, which is the restoration of damaged neural and brain tissue, and replenishing and optimizing the functionality of brain neural transmitters. And we were able to accomplish all that. We were not going to go to market unless all of our products were capable of achieving these. And then as we went to market, we included 2 other situations that we thought were very important. Our products had to have adaptogens that people could moderate and alleviate their response to stressful situations. And then number 5, we found out how vital and important the gut-brain axis was toward energy, mood, cognition. We included probiotics and prebiotics in all of our formulations via fermented products in order to optimize digestion and optimize the functionality of the gut-brain axis.
What's cool is because you've seen testosterone support supplements that have your standard nutrients, vitamin D, magnesium, Tribulus tonka. This thing's just different. This thing is a formula that packs a punch. And that's why it's, how do I say, it's easier to have just this in, what's the serving? 2 capsules or 1 capsule? 2 capsules.
I like to see men with the Man Plus take a minimum of 3 and
Yeah.
preferably 4, because that's
And
you get the significant we've been claiming, which basically some of the benefits, upwards of 40% of the men taking our product are describing benefits that basically are defying conventional science and
nice.
clinical medicine understanding.
Love it.
It's always been said that once a man had a complete male climax, that he would have some degree of a refractory period. And a refractory period is where you lose your erection. And that are taking our product as high as 40%, that have been taking it for over a year, because I want to stress how important it is that the benefits keep improving because of those vital and important physiological processes that I alluded to earlier. But anyway, these men are having multiple male climaxes, complete male climaxes, and they're not having a refractory period. We're basically at a point where we're starting to defy known clinical medicine and scientific understanding.
That's the best part, I think, of when people understand the power of herbal medicine or herbs, that they can now enhance cellular function, enhance their body function, and not need to, I won't say, not need to have to rely on, I have to go and get medication and be on this for the rest of their life. And you're proving in these formulas, like, you can put all that together. And I love that you have your standards that you got to meet. It's not just, hey, we're targeting one thing and not caring about the other. You're saying we're targeting one thing, but caring about the whole system, especially when it comes to the cognition in the brain side of things. Like, that's the most important. If you don't have that HPA talking, things are going to go awry no matter what.
You nailed it. All of our products not only have target specific benefits, but as I told you earlier, they had to stimulate those processes that we knew were important for promoting ongoing good health and longevity. Yeah, we're really proud of our products. And one thing I want to mention to you is I've talked to a lot of formulators across the country, and they said, you're hands-on. You are the one who brought the ingredients to your formulations. I said, most doctors that are involved in this business, they just put their stamp of approval, or they go to a formulator and say, this is what I want to accomplish. But in your case, you went to the formulators and you already had your plan of action as it pertained to the ingredients you wanted in your formulations. And the reason is because I studied these things for 6 years before I even thought of creating the actual formulations, and then of course taking them to market.
That's awesome. And it's funny because when I got your information, went to the website, and I'll be frank, I saw like only 3 products, and that had me very interested. It's like, normally you go to a supplement website and you see 10, 20 different products. I was like, okay, this is interesting. This might be new. But now I understand you don't need 20 different products. You have like one product for men, one for females, and then you have the clear focus, which is now you're taking all the stuff that you're good at and you can combine it into one, and it's like a one-stop shop, which is like, as you said, that's a great way to do it. And I wish more supplement companies would do, because I'll be honest, if you look at my supplement drawer now, it's a mix and match. Most of the things that you have in your supplement, I have as an individual, like, ones that I take.
Say this, any of the women that are taking Lady Plus, they're not going to need to take anything else in their lives, because they have every vitamin and mineral and amino acid that's necessary above and beyond the herbal ingredient. And that's why that particular formulation has so many benefits for women. It improves their brain power and brain health. It improves their lubrication. It improves their digestion and the health of the gastrointestinal tract, and of course, the functionality of the brain axis. It improves every structure in their body, whether it be long bone, muscle, or collagen. And in fact, the women who are taking this product are getting back to me and saying, I'm getting a lot of compliments about my skin, that my skin has a healthy glow, that my skin texture is really nice. And I'm noticing myself that the fine wrinkles are improving. And yeah, we have a lot of benefits for women that are amazing. And it has turmeric, which helps them with a mild to moderate amount of pain and inflammation management. We had a lot of women who used to have problems with a knee or a shoulder or wrist or whatever it might be. They're saying, that's gone. I don't have that problem anymore. And that's because turmeric is very, very potent for its anti-inflammatory properties.
Keep doing what you're doing. Absolutely. And I want to get to the clear and focus, because we also mentioned at the beginning energy drinks and Adderall. And I assume the clear and focus is going to take over that. But for people who might not be educated, let's start with the energy drinks first. Give us some insight of why these energy drinks underneath it all might be detrimental to someone's health. Because we hear like I'll take the big one, Celsius. There is a banned substance in it per the NCAA in certain sports that the athletes I work with and some people, they get kind of freaked out and they're like, what's this banned substance? And is this good for me? But at the same time, I don't think they question enough, because they're like, well, I'm still going to drink it.
Well, Clear Focus is amazing. It gives you a boost of energy that powers you through the day in a very healthy and appropriate manner. You don't get the irritability, the anxiety, the nervousness, the jitters that you get from too much energy drink or Adderall or other amphetamine products that unfortunately people are getting online in epidemic numbers and compromising their health and well-being. All of these, whether it be energy drinks, Adderall, or other amphetamines, in the short term, they can all cause cardiac arrhythmias, and they do. And some of these people, the cardiac arrhythmias are compromising and or deadly. As I said, being a physician, being someone who talks to a lot of other physicians, being someone who spent time in emergency rooms, ICUs, and those people that work in the morgues, they're starting to see, as I told you earlier, younger people in record numbers. And they're attributing a lot of that, as I said earlier, to the energy drinks, to the Adderall, to the amphetamine products that they're getting online. And on the short term, like I said, it causes arrhythmias. On the long term, it's even worse. And we're talking long term, we're talking 12 to 18 months. Once again, you start seeing cardiomegaly or enlargement of the heart. You start seeing hardening of the arteries, arterial sclerosis. And the net effect is high blood pressure and then increased risk, cardiovascular disease, and of course, associated with heart attack, stroke, and deep vein thrombosis. There's risk both on the short term and especially on the long term. Adderall and amphetamine products really compromise our brain neurotransmitters. They deplete the brain neurotransmitters and render them ineffective. Essentially, if you're on Adderall amphetamines over 18 months, it's going to become your neurotransmitter of choice. What happens when you try to get off this stuff? You're in a world of hurt. You go into a deep depression, the worst brain fog you could ever imagine, and it's hard to get going unless you get back on the Adderall. And that's what makes our products beneficial and effective and safe, is that it does not, it optimizes the quality and quantity of brain neurotransmitters and gives you that healthy boost of energy, and you don't have any side effects. And it's just, people have to really, as I said earlier, and you're going to hear me say this over and over again, anybody between 18 and 80, their number one priority should be their health and well-being. Well, if in fact your health and well-being is a priority, start looking for safe and healthier alternatives than going to caffeine, going to energy drinks, going to Adderall, because ultimately it's going to compromise you.
Yeah. And it's fascinating because, like I said earlier, like I grew up in the world of pre-workouts, and I started in the bodybuilding world as I studied in undergrad and grad. But you see a lot of these, we'll talk not energy drinks in a can, but the powdered pre-workouts. Some of them were getting stimulant heavy, that there was a couple companies, won't mention any names, but they were like 2 molecules or 2 formulas down from like straight amphetamines, and people were becoming addicted to it. I remember one of my friends, he took it and then he said, I can't work out if I don't have this. And it's the biggest thing. It's the reliance of neurotransmitters, just like testosterone, but these is probably more impactful, because they're giving you transmitter like intensity and sensitivity like no other. When you come off of it or come down from it, that's when people are going to have the real problems. And people don't know that. Just you'll hear anyone, yeah, caffeine's addictive, but these energy drinks are starting in pre-workouts and Adderall, they're starting to go above that. They're tapping into neurotransmitters that, yeah, of course you're going to feel good and they're going to go haywire. But when you come off of it, it's a different portion. And then you burn out the receptor sensitivity.
I've talked to many people who use Adderall on a regular basis and told me it literally took years for them to, after they weaned themselves off the Adderall, it still took them years to feel anywhere close to what they perceived used to be normal. Their brain neurotransmitters were just not working on a functional and efficient manner. Yeah, this is dangerous stuff. I'm not just doing this to be a salesperson and market our products. A lot of what I'm doing is because I really want to help the public understand the compromises that exist and that there's better and safer alternatives now.
That's the whole point, and that's why we love to have people like you on, because people, unfortunately, as a doctor, they're not aware. Like people like my parents, my family that aren't in this field, they'll go and the doctor say, well, we can put you on this, we can put you on this. They don't know the side effects. That's why I like to have people like you on to say, hey, here's a caution. Before you go on this, know all the side effects that can happen. And it might be hard to come off of this stuff because, yeah, neurotransmitters, when you start playing that game, holy smokes, that's a game that is way beyond what I know. And sometimes may be beyond what some of the doctors prescribing it actually know what it's going to do.
Well, it's in fact why cocaine and amphetamines are addictive, because of the effect they have on the brain neurotransmitters. And when these guys go days or try to go weeks without it, they are no longer functioning in an efficient or effective manner because their body is compromised.
Is Adderall very similar like a or amphetamine, cocaine, where it impacts dopamine?
Adderall's an amphetamine.
Okay. It'll increase the dopamine sensitivity of the brain, and you're like, hey, I feel really good.
Exactly.
Gotcha. Because I understood a little bit, but how to say, people market, was it Ritalin and Adderall, like you're going to be able to focus. And to me, focus is not the same as like a dopamine, like holy smokes, you're on a high, but I can see how it correlates.
Yeah, our product, it really boosts your energy and your brain power, and it does it in a healthy manner. And one of the effects it's doing, it's stimulating the release of dopamine in the body, dopamine, serotonin, and GABA. Well, we're hitting on all cylinders. And like I said, people aren't going to have the irritability, the anxiety, the jitters, the nervousness, and they're going to have that energy to power through the day. And one of the good things about our product too, is you determine the energy, mental and physical, and the mental clarity and focus that you want. If you want a mild boost, take 1 capsule a day. If you want mild to moderate boost, take 2 capsules a day. If you want a moderate boost, take 3 capsules a day. And if you want an Adderall or energy drink type of effect, take 4 capsules a day.
Okay. And it's when people hear this, they might not be looking at it, but I have it in front of me. It's not something that's like high caffeine. I think when people think stimulants or clear or focus, any kind of focus, they're thinking, it's got to have caffeine. But really, caffeine will help, but it's not really a big driver of focus and neurotransmitter. Like you need to have the building blocks of the neurotransmitters to be able to get the neurotransmitters to fire. And that is what the rest of these ingredients of your product is doing, giving the ability to open pathways and have transmitters, dopamine. We can make this. Plus, I assume if I took the man plus, or a female takes a lady plus the clear and focus, you're getting the amino acids, you're getting things that are going to translate over and say, we can create serotonin, we can create dopamine, GABA. All of a sudden, here we go, full healthy system.
Well, see, I'm glad you mentioned that, because our product, let's take Clear Focus for an example. It does have an immediate energy effect, and that comes from green tea extract, ginkgo biloba, and ginseng for the most part. But it's the long-term effect that we're promoting, and that's the most beneficial. The ongoing increase in the microcirculation through the brain, the restoration of damaged neural and brain tissue, and then the healthy replenishment and enhancement of neurotransmitter functionality. Those things are ongoing. And it's amazing how, when you continue to take this, how you just feel better and better and better. And it's from that long-term effect that's occurring, not the acute effect from the ginkgo biloba, the ginseng, and the green tea extract.
Yeah. And that's what everyone should be thinking about. Long-term effect from a supplement like that. Yes, I mean, I could benefit from the short-term effect. If I'm going to say, hey, I'm going to take this 30 minutes before my workout, I feel good. But then the rest of my day is going to be set with the long-term. So there's ways you could use it both. I could use it both. But I think most people should focus on long-term and not chase that, hey, I need that quick boost. I'll let it happen. And your brain, because you have Lion's Mane, you got nootropics in here. You have everything to help, like you said, your criteria.
Yes, we're very proud of it. It's a great product. A lot of people are their lives have changed dramatically, and we're a relatively new company. And yeah, like I said, we do have 3 products. We have 4 that already been formulated, but we're holding off until we get these products in the mainstream. And we're excited about what we're doing. It's been much fun. It's become a passion. I don't consider this a job at all. My job was when I was a surgeon, and I retired from that. And I still consider myself retired. And the last 11 years have been the most enjoyable years of my life. I have never been this active, this productive, this fulfilled, and this excited about everything I'm doing in life now.
That's awesome. And what made that shift from, I know from being like, hey, I'm a doctor, to I'm going to design herbal medication that's really going to boost people's overall health? Like, what was that shift like for you?
Well, I had an injury, and I was 58 and a half, and I thought I'd be back in 2 to 4 months. Well, that didn't happen. And over the course of 18 months, I ended up having 5 major surgeries and 3 minor surgeries. I became addicted to OxyContin. And the combination of, after I withdrew from the OxyContin, I knew that physiological addiction was past me. I had an unbelievable amount of course, what we know now as brain fog. I was just mentally and physically lethargic and stagnant. And of course, not being in the operating room in the prime of my surgical career was a bit depressing to me also. That combination of factors put me in a bad state of mind. Of course, all my doctors wanted to put me on antidepressant, mood stabilizers, and sedatives. The antidepressants to get me out of my depression, the mood stabilizers to enhance my mood, and the sedatives to combat the anxiety I was experiencing. I wasn't going to go that route. I had just gotten off of narcotics. All the medications I just mentioned, the classes, the antidepressants, the mood stabilizers, the sedatives, the prescribed sleep aids, they all cause some degree of brain sedation, cognitive impairment, diminished motivation, and altered or blunted personality.
Yeah.
Too much. I just wasn't going to go that route. And one of my colleagues is a gentleman of Chinese descent. He had studied Chinese herbal medicine, and he thought that some Chinese herbs could help me because he knew I was not going to move forward with the pharmaceutical route. And I was hesitant at first, but I went to a marketplace in Irvine. There was a lady there who had been a pharmacist in China, very knowledgeable, very pleasant lady. We had a great discussion. And I ended up getting a packet of capsules that had 5 herbs in them. And I was hesitant, like I said, but eventually I felt like I had nothing to lose. I was pretty desperate. I started taking them. And within 3 weeks, my energy mentally and physically was back. My mental focus and clarity and cognition felt stronger than ever. And I knew I was onto something really good. And then 3 to 4 weeks later, I started noticing some amazing benefits in the benefits, fulfillment, and pleasures of intimacy. And I just started running with this. I couldn't study.
Awesome.
I couldn't study and research these herbs enough. I was on track. I knew I was on to something special, and it just captivated my mind and my attention and my energy.
And I do think, like you said, you were skeptical. Many people, when they hear herbal medicine or like Chinese herb medicine, they're very, very skeptical. But the stuff, I mean, I've taken some of the herbs and some of that supplements. Like, I swear by some of that stuff. And like anything else, you want to keep it like your lifestyle. You want to keep it kind of like drug free, or you don't want to be relying on like pharmaceuticals to really drive anything. if these herbs make it happen, how can we add them to anyone's routine and lifestyle to make them healthier? And now with the realm of adaptogens and neurotropics coming out, we're getting into the realm of like what plants can actually do for us, which is awesome.
Our maker, our God, whatever you want to call, whoever put our earth together, they put these things on the planet for a reason.
Yeah.
And let me tell you, I am 1,000% a believer. I'm a firm believer. This is, like I said, this is now my passion to bring to the attention of the public the tremendous benefits with negligible side effects that these combination of herbal ingredients have. The nutraceutical industry has an opportunity to be on par or even beyond the pharmaceutical industry as it pertains to a lot of conditions that can be treated and benefited. I'm of the belief, but let me just take these categories. When it comes to the realm of antidepressants, mood stabilizers, sedatives, prescribed sleep aids, narcotics, they prescribe 70 to 80% beyond what they should be. And it's because the doctors are overworked. They don't do their homework. And it's easy for them to just write a prescription instead of saying, let me research and see whether there are alternatives that are out there. Many people have been compromised in and of themselves by these classes of pharmaceuticals I just mentioned. Well, now I'm here to tell the public there are better, safer, and more effective alternatives.
And that is we haven't mentioned it. Where can people find these products? Where can people find you?
Yeah, our website has a lot of good information, a lot of great blogs that we've written that are very informative and, of course, tells them all they need to know about our products. Recomnd.com. And we spell recommend RECOMND. RECOMND.
This is where a lot of your average people struggle, because they go in and they maybe to the local CVS or supermarket and they look at the vitamin section and they really they don't know what's going on. That's why it's stuff like this, where these supplements are becoming integrative into your lifestyle of, like you said, exercise, eating, and taking care of yourself. They're giving you that boost and enhancing quality of your health, and in a one-stop shop. Like that's the point. We don't want people getting so super confused with, I have to take 25 different vitamin this, vitamin that. It is all here in 2 capsules, 3 capsules, 4 capsules, depending on the dose you want and the effect you want. And I think that is where this world of herbal medicine is really going to start taking off, with a company like yours saying, hey, this is what the standard is. This is how we're going to do it. And you don't need more than that.
Yeah, we definitely, like I told you earlier, we had criteria we had to meet before I even thought of going to market with these products. And I don't want people to think I'm thumping my chest or patting myself on the back, but I had the background, the extensive science background, pharmacology, pharmacodynamics, pharmacokinetics, clinical medicine, to really understand what these products were capable of, what these ingredients and the combinations were capable of. And people have to think of it in this manner, that they are nature's ingredients that were nurtured by scientific precision and engineered by a doctor who had the understanding of how to combine the formulations. Like I said, our products are unbelievably effective, they're extremely safe, and they promote ongoing good health and longevity. And I think these are the keys to optimizing and keeping your health as your number one priority. That and what I alluded to earlier, a holistic lifestyle that everything about it promotes our ongoing good health.
And that's what's going to set an individual difference between, hey, I'm just going to make a product to make money, which I've talked to those people, versus a person who is a passion because they've seen what it does for them. They've seen what it does for other people. They have a passion of, how can I make this thing the best? And I'm sure you sit there, just like I sit here with exercise programs and modalities. How can I make this better? What can I add here to drive an enhanced lifestyle and health? And those are the people that we want driving these companies, these formulas, because you might come out in a couple of years being like, I missed this and I researched this. Guess what? New formula. Boom. This is going to change the game. And that's the passion I can see behind you. It's like, what's next? What can we do? And we as the general population, we got to thank you for that, for bringing this stuff to the airwaves, to our ears, to our doors when people order it.
Yeah, I appreciate that. Like I said earlier, it's just exciting. It's been such a passion. And one of the things I want to allude to is this whole thing of anti-aging, longevity. Not only myself, but I talk to a lot of my friends and colleagues that I hang around with when on my free time, when I'm playing golf or working out at the gym. And we all agree, what's the point of getting old if you're not going to have an active lifestyle, being productive, have some fulfillment and fun and excitement? And that's kind of the way we also geared our products, with that mindset to help people not only improve their longevity, but to improve their longevity in a very active and productive manner.
Absolutely. Well, I know we're a little over, coming up on an hour here, and I always like to respect people's time. Anything else you wanna hit or get on? I mean, we dove into it good. That was great.
No, I think we covered most of the bases.
Awesome.
This was a great discussion, a great interaction. I appreciate all your feedback and all your comments.
Yeah.
Matt Gluckman and Eric Menchie here from Think Fitness Life. Our entire careers have been dedicated to fitness, particularly how the mind helps the body. We've been around gyms and nutrition strategies for 25 plus years collectively, and nothing harms or helps better than your own mind, untrained or trained. Pushing beyond your limits, overcoming whatever's thrown your way, and making the decision to show up day in and day out as a lifestyle takes more soul than sand. And what I mean by that is when you can get your mindset and heart leading you consistently in the direction of your goals and dreams, well, it's just a matter of time before you have the performance, physique, or quality of life you're yearning for. See, your thoughts will stem from your beliefs, which will then lead you to action, which develop into your behavior and ultimately lead you to results. It's really that simple. Our process takes time and it takes open communication. It's amazing what pops up along the fitness journey to betterment, and we can be there every step of the way. To learn more or apply for coaching, visit www.thinkfitnesslife.com. Start recreating your life today.